2-minute doc. In today's episode of Simply Pathology, we're going to see about Crohn's disease. Crohn's disease is an inflammatory bowel disease. We all know another inflammatory bowel disease called ulcerative colitis. Now, Crohn's disease involves almost the entire gastrointestinal tract, right from esophagus to the rectum. But the most commonly involved site in Crohn's disease is ileum, which is a part of the small intestine. Rectum is usually spared in Crohn's disease. In Crohn's disease, there will be transmural involvement, which means that the entire lining of the gastrointestinal tract, starting from the mucosa to the serosa, will be involved by Crohn's disease. And in Crohn's disease, we characteristically see a thing called there will be lesion followed by normal mucosa in between, and then we'll have another lesion. So this type of lesion, presence of lesions with intervening normal mucosa is called as skip lesions. So the overall appearance of the mucosa of the lining the gastrointestinal tract appears irregular, and this type of appearance of the gastrointestinal tract mucosa in Crohn's disease is characteristically called as cobblestone mucosa. The clinical features of Crohn's disease are because of the inflammation. The patients will have abdominal pain, blood in stools, a fever. Perianal fistula is very common in patients with Crohn's disease. Apart from this, there can be features of malabsorption like steatorrhea and megaloblastic anemia because of impaired absorption of bile acids as well as vitamin B12. The diagnosis of Crohn's disease can be done by detecting specific antibodies such as anti-Saccharomyces cerevisiae antibodies. This is present in most of the patients with Crohn's disease. Endoscopy and colonoscopy can be done to directly visualize the lesions. 2-minute doc is a part of the YouTube channel MedVidsMadeSimple. If you enjoyed this video, please make sure to like, share and subscribe to 2-minute doc for more short and crisp 2-minute videos. Please read the description of this video to know how you can support our channel without spending even a single dollar. You can also support our channel directly by donating on Patreon. Link is in description. Thank you for watching. See you tomorrow in my next video.